everyone. In this short clip, we are going to review the cognitive behavioral model. So unlike the psychoanalytic approach previously spoken about in the second video, this model is very much focused on the present. We're not so much concerned about childhood experiences, right? We are looking at the now. We're very action-oriented and structured. If someone is having a problem with abnormal functioning, a therapist is going to look at the client's behaviors, look at their thinking patterns, and try to figure out how we can change the behaviors and the thinking patterns to make their interplay more beneficial to the person. And what I mean by that is how one affects the other. When we're looking at the interplay here, that's a key, that's a big like buzzword, right? We're looking at how our thoughts influence our behaviors and how our behaviors influence our thoughts, okay? And when we take those, we're looking at how that interplay between the thoughts and behaviors is going to affect our feelings and our emotions. And we're going to kind of dive into that with a more thorough example concerning social anxiety that's in our text, because it's a really good example. This is going to draw from classical conditioning, operant conditioning, and modeling, various forms of learning, and I'm going to refresh you on those very quickly, but those are important to remember, okay? Please make sure you watch the video included in this PowerPoint. It's a TED Ed video. It's a great resource. It's on the next page. Behaviorism is such an important component to understand as to why people develop the behaviors that they do, okay? And in addition to that, we're drawing on the cognitive perspective, so looking at why do people have such irrational thought patterns? Why is their thinking so dysfunctional? For people with social anxiety, why do they think that they are a horrible social human being? Why do they feel like they're unattractive socially? We're going to that's the point of cognitive behavioral therapy, and within this model, we're kind of confronting those disordered lines of thinking and seeking to change counterproductive behaviors. That's important. So here's that video I was talking about, the difference between classical and operant conditioning. Classical is associating stimuli. Operant conditioning is learning through consequences. So make sure you watch this video for a further example. It is included in this PowerPoint as well as your supplementary materials folder. Now, with the behavioral dimension, let's break this down. The first part, the behaviors, right? What are behaviors? The actions we carry out. So we're looking at our behaviors and what people are doing that's counterproductive. What is dysfunctional about someone's behavior, right? Because the way we learn abnormal and normal behaviors and functioning is going to be the same. There's just a disruption in the process. Maybe there's some abnormal conditioning that occurred, or maybe some different consequences that skewed the process, the learning process. So remember, it's going to follow the same methodology, but it's just what we're associating, what we are learning is going to be different. So, for example, let's look at this first bullet. Abnormal behaviors as learned, like I said. What we're trying to do, though, is replace them with more appropriate ones. So if I see someone's engaging in an abnormal behavior, such as they have social anxiety, and they've decided that they are going to avoid any kind of socialization outside of people within their family. Some of you may say, I'm an introvert, I love that, right? But that's, on some level, that would be an abnormal level of functioning in terms of your social needs as a person, right? So we want to replace that avoidance behavior with something more appropriate to get that person involved. We're just speaking of the behavior right now, not the thoughts that go with it. So with classical conditioning, we're looking at responses to stimuli comparative to another. So we learn to associate two things together. So for example, if we're going to look at a fear response, let's use fear of needles, right? If any of you have a fear of needles, that probably started because you went to the doctor one time, and right before you had this giant surge of pain, they gave you a needle. So now every time that you go to the doctor, you've associated that needle or the sight of the needle with that pain. that is classical conditioning, right? Sometimes even we learn to associate the doctor with that pain because maybe the nurse didn't give you the shot, but the doctor did. And so now when you see that doctor who gave you a shot, you look at them and you think about that pain that came from their intervention. That's classical conditioning in a nutshell. Again, you should have a fair understanding of this. If you don't, please make sure you review the video that I sent you or ask me any questions. I'd be happy to talk about it since it's one of my favorite topics. Now, if we learn a fear response, a fear behavior through modeling, let me use an example of a little boy I used to nanny. He had a deathly fear of bugs, right? And he screamed, he ran, he cried whenever he saw a bug. And that's a bit of an extreme reaction considering he never had a personal experience with that bug. Well, one time I happened to see his mom's reaction when she saw a bug. Suffice to say, I think that fear response was modeled to him because what did the mom do? She screamed, she cried, she shooed it off. She reacted so largely. And so that young boy I used to nanny learned that response through modeling, through observing his mother's response to that same stimuli. So that is an example of modeling. We can also learn modeling is very useful for understanding like roles, sometimes gender roles children engage in, as well as aggression, things like aggression. So behaviors that kind of border normal and abnormal, right? Because remember, again, these can be used to learn abnormal as well as normal behaviors. And then we have operant conditioning, which is just learning through consequences. So things that produce satisfaction are going to reinforce a behavior, make it more likely to occur again. Things that produce an unsatisfying result, those are going to be punishers. So in a simple example, for good and bad behavior, let's say you hit your sibling. That is something you should not do. That's a normal part of learning as children, right? So maybe your parents punished you and made you take out the garbage. I don't know, some kind of chore, right? They were trying to make something unsatisfying as your task so that you would be less likely to hit your sibling in the future. Now, for reinforcers, I would use this method if I want someone to do a behavior again. So let's say you all got 100 on our first exam. Wow, that would be fantastic, right? I would want you to do it again. So you all got a 100 and I said, you know what? Y'all did so well, we don't have any homework this week. That is a satisfying result, right? So the odds are, because you know I'll reward you after getting a good grade, you'll try to get a good grade again. Again, this can work for both normal learning and abnormal learning of behaviors. So, let us go to the cognitive dimension, and then we'll tie it all back in with our social anxiety disorder example. So with cognitions, anytime we mention cognitions, we're just talking about thinking, right? Well, in this case, Albert Ellis and Aaron Beck, who are pictured here, Aaron Beck's here, this is Albert Ellis, they said, you know what, it's great to look at behaviors, it's observable, we have some predictability, we can kind of predict what people are going to do in different scenarios, but we also have to understand their thinking. So what is going on in their head when they're doing these behaviors? How do they feel about these behaviors? How do they feel about the scenario that makes them want to change their behavior, right? That's what we're looking at. We're trying to find the assumptions of the client and their attitudes and their conclusions. So if someone is depressed, for example, they tend to have illogical thinking processes, with one of which being overgeneralization. So people with depression tend to think something along the lines of, life is a crap sandwich and every day is another bite, if you've ever heard that saying. So things are horrible because I'm horrible and the whole world's horrible and it's always going to be horrible. That is an illogical thinking process. The person is taking one small instance. So maybe something bad happened that day, like their dog died, which would be a horrible event, granted. But they're kind of stretching that. So when you generalize something, you're spreading it out to the general populace. You're applying it to everything. So maybe they're saying, oh, you know what? Well, that's just a part of life, and life sucks, and it's happening to me because I suck, and that it's a detrimental. I'll be honest, depression is a disease that lies to you, right? That's what I had one of my professors tell me in my undergrad, and I always remember it because it's a good way to think about depression, especially if someone has it. It's a disease that lies to you. So you have these illogical thinking processes, and that's what we're looking at in the cognitive component. So how do those illogical thinking processes lend themselves to someone changing their behavior? Or how do they rationalize a behavior? So let's use an example of social anxiety disorder to kind of blend it all together. This is the example listed in your text, and I thought maybe if I talked about it, it would kind of help you understand. So, with social anxiety disorder, people have a terrible phobia of being in social situations, to say the least, right? So they may avoid these situations altogether. They may refuse to enter social situations or very briefly participate or do different things, right? It's because of the cognitions in place, right? So they have these illogical, dysfunctional thought processes saying, I'm an unattractive social being, I am socially unskilled, just all of these kind of negative processes surrounding social interactions. So that's the cognition component. Then you have behaviors. So in this case, we're looking at avoidance and safety behaviors. So avoidance behaviors are exactly what they sound like. You avoid the situations. Maybe you don't go to that party. Maybe you don't take a public speaking class if you're terrified of public speaking and have social anxiety. You're avoiding it altogether. Safety behaviors are things that kind of mask the social anxiety when you're in the scenario. So I think the book uses an example of like makeup. If you have this horrible cognition surrounding like your face and how you appear. I'm not saying all people who wear makeup have a problem with their face, but you know. So these behaviors, when they engage in these behaviors, they're reinforcing. But how? Well, they relieve our anxiety, right? If you have a terrible fear of public speaking, you're going to try to avoid that any way possible. And when you avoid it, I feel so much better, right? When you avoid that one anxiety-provoking thing, well, then it gets reinforced. Well, if I just avoid it, I feel fine, right? So we want to change those behaviors so that the person can engage in the social scenario. So it's very, again, confrontational almost in a sense, the CBT, when you do cognitive behavioral therapy, because it's trying to confront your disordered thinking and disordered behaviors. And so that's kind of the next question we look at. Do we confront our thoughts or cognitions, or do we accept them? Right? Because we can change the behaviors through different learning models. But with our thoughts, we kind of have two approaches here. Do we expose the person to those situations that would bring about those horrible thoughts and teach them kind of, let's judge your thoughts. Here's why they're wrong. Let's go through it. Let's do some homework and really analyze this. Or do we tell the person, hey, acceptance commitment therapy, you know what? We all have bad thoughts sometimes. And I think you should just accept them as they are. They're just thoughts. They don't carry weight. They are just there. Acknowledge them and let it go. Right? So two different approaches. Do we confront it or do we accept it? Right? And those are oversimplified, brief examples. But you get what I'm saying. It's still a very therapeutic, it's a long process and very systematic. I'm just trying to briefly define it for you. So this is a great approach to understanding abnormal functioning because we're looking at cognitions and behaviors, thoughts and behaviors, and how they work together to affect our emotions. So the pros of this approach is that it can be tested in a lab and has been extensively tested in the lab. It has impressive research support and has been shown to be able to predict behaviors, because that's one of the components of behaviorism, is it made psychology so objective in the sense of observing those behaviors, it has given us some ability to predict what people will do. So that's excellent. But it also has limitations, because it's saying that behaviors and thoughts are a result of abnormal functioning. But what if they're the cause of abnormal functioning? Does that make sense? So we're looking at both ways, right? And what we've talked about, we've looked at how behaviors and thoughts interplay with one another and play out in a dysfunctional manner. But what if the behaviors and the thoughts are actually causing our abnormal functioning? Like we just started engaging in a behavior and it turns out abnormal on some level. So we have to look at both sides of the coin there. So is it a result of some abnormal functioning, or is it a cause? Also, cognitive behavioral therapy does not help everyone. Maybe some cases are more severe, and maybe some people just can't confront or accept their dysfunctional thinking. That's something that we're challenged with. And the last kind of point that we're going to get into that leads into humanism and the rest of the points we're going to look at is there's two aspects of functioning we're examining here: cognitions and behaviors, and a little bit of emotion, but it's somewhat shallow. There's so many other points we have to look at, such as, what motivates people? What are their desires? What are they interpreting from these situations? There's deeper levels of thinking occurring that we're not really looking at outside of this kind of cause and effect interaction. And that's what we're going to look at with the next part with humanism and the other differing perspectives. I'm going to kind of lump them together.